Hi, hello, everyone. Today, instead of talking about me, I'm going to talk about my husband. My husband also has a rare condition. It's called multiple venous malformations. Remember when he got that diagnosis, I asked the doctor, can you give it a name? And he's like, that is its name, multiple venous malformations. I felt like that was a symptom. I wanted a name. Yeah. So let me tell you the story and explain what exactly it is. Excuse me. One of my symptoms, I just choked for no reason at all. Sorry about that. Okay. Oh, all right. So my husband first noticed that he had an issue when he was in high school playing football. I think he was around 16 years old. And his knee would swell up really bad after practicing football. And he would get really tired and he'd have to rest. And sometimes he couldn't bend his knee. And he just figured it was something that comes from exercising. He did notice it wasn't happening to anybody else, but he dealt with it the best that he could. And then when he was 19 years old, he went on to serve a mission for the Mormon Church, and he was sent to Cancun, that area. He was also in Isla Mujeres and maybe Cozumel, I'm not sure. But there was a lot of walking and riding bikes and a lot of physical activity all day, every day. And it was too much. And his knee got really, really, really bad to where he ended up needing a surgery. And at that time, the doctors in Mexico said he had a hemangioma. So how do I explain a hemangioma? It's like a big bubble of blood vessels. And I guess, now I am not a doctor. I'm a wife who's had a lot of experience with medical, but I am not a doctor or nurse. I'm not a medical professional. Yeah, it's like this big tumor of blood. And so they surgically removed it and said, that's going to fix your problem. He didn't have any physical therapy. He was stuck laying in a bed for months to recover. And then when it was time to get up and start walking again, he couldn't bend his knee. And it just wasn't a great experience. They ended up sending him home eventually. And home at that time was Utah. And he saw an orthopedic doctor that didn't address the hemangioma. At that point, they thought that was resolved. And they said that the cartilage in his knee was hurt. And so they did orthoscopic surgery on his knee. And then he had physical therapy. And he said the difference was night and day, that anytime somebody has surgery, they need to get physical therapy. And so then that was pretty much it. He said they told him that he had the knee of a 60-year-old man. And at this time, he was 21, I think. So he married me when he was 23. And I noticed the veins in his thigh looked really weird. Like he had really strange, bad varicose veins, which I also had no experience of, but I imagined this is what they look like. They were all bulgy and they bent funny and you could see them poking out of his skin. And I'm like, I think that's related to your condition. He goes, no, it's not. My leg just looks like that. I'm like, okay. Because it had felt like I touched a nerve. So I just left it alone. And then we're going to fast forward. We were married we got married in 92. It was 95. He started having really bad pain in his leg again. And he thought that he just needed another orthoscopic surgery. So we found an orthopedic doctor to look at his knee and discovered that the hemangioma had grown back. And so the hemangioma was actually a lot bigger than it was before. It went from his knee all the way up to his buttocks in that leg. And so the doctor decided what we want to do is we want to put in alcohol injections to cauterize it. And he did do another orthoscopic surgery to basically removed his meniscus because it was torn to shreds. Yeah, so it seemed at the time that the alcohol cauterization was a really great answer. So that went well. And then my husband was back supporting our family. I was a stay-at-home mom. We had 4 children. And then let's see, what triggered it again? We moved to Utah. We were in Arizona when that happened. Sorry, we jump around a lot. Move around a lot, I should say. We don't really jump from state to state. But yeah, we were living in Arizona for that surgery. Then we moved to Utah in 1999, and he started having problems again. I think actually it was around 2000 when he started having problems again. And this time, he got a diagnosis of Klippel-Trenaunay-Weber syndrome. We now know that is not what he has, but at the time, that was his diagnosis. And with Klippel-Trenaunay-Weber syndrome, you get multiple venous malformations in one leg. Now, I apologize if there's anybody watching this that knows more about Klippel-Trenaunay that wants to comment, please go ahead and do so. I am not an authority on this. Now, as I said, it turned out to be the wrong diagnosis for him. But we met a really great radiologist at the University of Utah. Don't remember his name. But he did this thing, I think it's called a venogram. It was amazing, where he injected some dye into my husband's leg, and we were looking at the leg on this big screen on the wall, and you could literally see that my husband had more veins in his leg than he did muscle. That is not normal. That is really strange. That is when we first learned this was a birth defect, that there was nothing that had happened to him to cause it after he was born. It was a birth defect. And after discovering it was a birth defect, my husband talked to his family, and they told him a story about how when he was 2 years old, he had a big tumor lump on his neck that had to be surgically removed. And up until then, he had never heard of it. He didn't know anything about it. So my husband actually ended up becoming disabled at that time. Yeah, that's when it happened, 2000. He hasn't been able to work a regular job since then. So then later, we ended up, because that doctor, I'm trying to think if they did more alcohol injections. I don't think they did. They said they decided that the alcohol injections actually made it worse because it grew more in different directions. And so we didn't do any more alcohol injections. They just recommended compression stockings, and that he needed to stop. He was a truck driver at the time, and that was not working for him. So we ended up shortly after that, in 2001, we moved to Nevada. And while we were in Nevada, he developed some new symptoms. It was, it was pretty scary because what was happening to him was so rare that anytime we went to the emergency room, the doctors didn't know what to do with him. They did do a colonoscopy and discover that he had these venous malformations attached to his colon. In some places, they were opening up holes, And when his blood would get the bacteria from his colon in it, he would develop infections. And that was very frightening. But then he was getting these other weird symptoms, like these weird headaches and strange behavior, and they didn't know what to do. And so we had found in Rochester, Minnesota, at the Mayo Clinic, there was a doctor that was familiar with Klippel-Trenaunay and seemed to know more about this stuff than anybody we could find in Utah or Nevada. And so from Nevada, we moved to Rochester, Minnesota, specifically to get medical help for my husband. And when we got there, we discovered he'd been having mini strokes. So part of it, this part is not related to his condition, we don't think. But he had a PFO, which I don't remember what that stands for. Let's look up the definition. PFO, heart. It stands for a patent foramen ovale. And it says, it's a small opening between the two upper chambers of the heart, the right and the left atrium. Normally, a thin membranous wall made up of two connecting flaps separates these chambers. No blood can flow between them. So my husband had a hole in his heart, which is fairly common. I don't remember the percentage, but it's more than 10% of the population has it. But if they don't have a problem, then they'll never know about it. So we learned later that my husband's condition causes him to form more blood clots. So the blood clots were going through this hole and getting up to his brain and causing him to have these mini strokes. So I'm very grateful to the Mayo Clinic because they were able to identify these little strokes and the brain damage, whereas the doctors we were seeing in Nevada were not successful at doing that. And they also were the ones that were able to explain to us what was happening in his colon. So we stayed there from 2003 till 2010 because it was just great that they could answer questions and stuff. So we learned there that it was not Klippel-Trenaunay syndrome. It's something called multiple venous malformations. And what this means is throughout his entire body, we're talking from the top of his head to the bottom of his feet, he has excess veins that form like clumps. And so he was born with them. But until a clot or something gets stuck in one, it's like a deflated balloon. And when it inflates, that's where the problem is. And as he gets older, more and more of them inflate. So he's got some on the bottom of his feet that make walking difficult. He's got the ones in his legs that I've talked about. There are some that are close enough to the surface that he's had a couple surgically removed, but most of them, that's just not an option. And frankly, the doctors, even at the Mayo Clinic, don't want to operate on them because there's too high a chance of him bleeding to death. One treatment that he had, I should say they closed the hole in his heart and that stopped the strokes, which was good. Then one treatment he had is they put him on a blood thinner for a while, and that actually made him feel a lot better. I think it's because it made the blood flow through these malformations a lot easier so they didn't get stuck and blow up. But yeah, so in many places in his body, especially that right leg, he has more vein than muscle. Doesn't that just blow your mind? The doctors say he's a miracle because he shouldn't be able to walk, or he shouldn't have been able to play football. He should have been worse off much younger. He's 52 now, and he's not able to have a regular job. He does Uber, but mostly he's just home on disability because it causes a lot of pain. Because when they blow up, they push against nerves and take up space where nerves and muscles should be, and organs. And so that's hard. Another symptom that he has is that it's in his meninges. Your meninges is the lining of your spinal column and of your brain. And sometimes that makes a buildup of spinal fluid, and he gets these horrible, horrible, horrible headaches. And then he has to go to the neurologist and have them take out some spinal fluid for him to get a relief. Some relief. Sorry, I talk funny sometimes. But what prompted me to make this video is his most recent challenge with his condition. It just blows my mind because he always gets these weird problems. I mean, yes, I'm sick too. I have strange things, but my husband, he gets some weird stuff. So I don't know how long it's been, like 5 years ago or something. I don't know. He started having a problem with the crystals in his ears. Did you know you have crystals in your ears? Now, these are not the woo-woo crystals that I like to play with. It's not selenite or amethyst. I don't know, they're supposed to be there. So they're not like kidney stones or gallstones. We have crystals in our ears. Everybody does. And they're there to help us keep our balance. Isn't that fascinating? And, but if they get stuck where they're not supposed to be, it makes you very dizzy. Like sometimes he can't even stand up or he's vomiting. Fortunately, there are special physical therapists that are trained especially to help with this problem. And so there's one that he goes to see every time it happens, like is approximately every 6 months, he has to deal with this all over again. And sometimes it's harder than others because I guess it depends where the crystals got stuck, how hard it is to move them, whatever. But I guess I kind of went in the wrong order. He has these venous malformations in his head, okay? There's one behind his left eye that he has to go see an ophthalmologist regularly because it could cause him to go blind. But the one that's causing a problem right now is pressing against his eustachian tube in his left ear. It might be that same one as the left eye, I'm not sure. He has them in his face and in his jaw. He has one over here in his neck. Anyway, the one pressing on his eustachian tube was causing him a lot of frustration. And so a well-meaning ear, nose, and throat doctor said, hey, I've got a fix for that. We'll just put a tube in your tympanic membrane. Sorry, I didn't say that right. Tympanic membrane. And then you'll be able to get some relief of the pressure from the outside, and everything will be fine. Well, that was a great idea, but it didn't work. My husband's body rejected the tube. Your body can reject any foreign object. Anybody's body can. And unfortunately, they don't know if it's going to happen until they try it. So it got really infected. And when we went back to the doctor, it was so infected, the ear had pushed that tube out. We should have taken that as a sign. Pushed that tube out. And so the doctor cleaned it up, put in a new tube, put him on antibiotics. The next time that we came back, so infected. And the ear had made a big hole in the tympanic membrane. And so that doctor kept watching him. He took the tube out, treated the infection, put some special sealant on his ear to try to get it to grow closed, and worked with him, but it didn't work. The infection got better, but his tympanic membrane basically just dissolved to where like 70 to 80% of it was gone. So he said, I feel really bad. It looks like you need surgery. So that led to him getting ear surgery. So we went, I've learned from this, our ears are very fragile. Take care of your ears. When they tell you not to stick stuff in there, listen. But we went to the surgeon who is seeing my husband now, and he's a great surgeon. They did a hearing test, and not having your tympanic membrane really affects your hearing. He is having a lot of hearing loss. And so they went in and did the surgery. I was really nervous about the surgery. I said, can you just give him a hearing aid? And he said we could, but the risk of infection goes way up. And so it's really better if we fix it. So my husband wanted to get it fixed. So we went and got it fixed. So this is how the surgery went. They cut behind the ear so they could flip the ear over. And the reason they did that is so that they could get a better view into the ear canal and have more space to work. It also turns out my husband has small ear canals that are shaped like an L. And so they had to do some plastic surgery on his ear canal to widen it. And so that was more surgery than we expected. And then when they got in there, because it had been open, which I didn't think it was that long, but I guess it was long enough, he developed otosclerosis, which means that the 3 little bones that make you hear were fused together with bone. So you have the incus, the malleus, and the stapes. So they put in a prosthetic incus bone. And there was also a lot of chronically inflamed tissue in there from not having the tympanic membrane. That brain is really important. Sorry about my voice. So they cleaned out all that chronically inflamed tissue. And then they took this little piece of cartilage. Sometimes people get it pierced. They took part of that out and used it. That shows you how small your tympanic membrane is, right? They used it as a graft. And so they made a new tympanic membrane out of it. So the surgery went really well. Oh, sorry, itchy nose. The surgery went really well. I'm convinced we have a really good surgeon. Because of what had happened with the tube, there were other options for prosthetic tympanic membranes, but he thought we should use as much of my husband's tissue as possible because we don't want to risk the body rejecting it. So the doctor anticipated that my husband would be able to get back to Uber within a week, right? But my husband hasn't reacted that well. And I really think it's related to his condition. So when he first got out of the hospital, I was like, yes, he seems well. Everything's going to be wonderful. He still couldn't hear out of his left ear because there was so much packing in it. But that was just surgery, right? And then about 24 hours after surgery, he got really dizzy. And he said it was like the world was going up and down. And he was vomiting, and it was horrible. And that went on for about 24 hours. For the dizziness continued for about a week. I don't know if you call up and down dizziness, but I don't have another word for it. And then he saw the doctor a week after surgery to get the first set of packing out. And they talked about how he was feeling. So they prescribed him some prednisone, a seasickness patch, some anti-nausea medicine, and that helped. And then he went back a week later. Sorry, my nose. And the dizziness had changed. Instead of being up and down, it was the normal round and round. He's still not really hearing out of that ear, and they're like, that's okay, you're still healing. So they switched him from Zofran to Phenergan for the nausea and the dizziness. And they took out the second packing, and then they told him to come back in 2 weeks. So that was yesterday. So yesterday, today is 4 weeks after surgery, but yesterday was his last visit. And so actually the past 2 visits, they treated him for the crystals, and once in between he went to his regular lady to be treated for the crystals. And a couple of nights ago, he developed a horrible, horrible migraine. So he's dealing with his malformations, recovering from surgery, the crystals, and the migraine. It's a lot. It is a lot that he is dealing with. And we don't know if this is all just side effects of surgery or if he needs to go in and have some spinal fluid drained. There is a storm system coming in right now. The storm systems always make him feel worse. And gosh, I wish I could put a positive at the end of this. Let me figure out how. But the doctor wants to see him again in 3 weeks. And I'm really, really hoping that within 3 weeks, he'll be well enough that he can go do Uber. Right now, he doesn't even want to have company because he can't stand listening to people talk. It's hard for him to watch TV very much. Riding in the car makes him sick. It's just miserable. But yeah, he's got these venous malformations, like I said, in his head, in his feet, and everywhere in between. He's got some in his low back. There's one that's inside his psoas muscle. That's in your low back. And that just gives him a lot of discomfort. And it's so rare. They really don't know what to do for it. Most people that deal with it are children. Yeah. So he loves talking to people that that just need someone to talk to about it, because he knows what it's like to feel like you're an alien, the only person on the planet with this condition. And yeah. So I just wanted to share that with you. Just have it documented, multiple venous malformations. It's different. And it's yeah, these rare diseases, people with rare disease, we got to stick together, you guys. We got to support each other, and we got to share what we learn, so that if somebody else has it, then they know that they're not alone and they might get some tips. If you have it, or if you have a child that has it, let me give you some uplift. He did play football. He was a truck driver. When he feels up to it, he does Uber. It's not like, okay, some people might think, well, if he can do Uber, why is he disabled? It's because there are some months he can't. But when he can, he loves driving and he loves talking to people. He used to be able to work on cars. He's got a degree as a mechanic, but he can't bend over and get under a car anymore. So he will talk to friends. He can help diagnose what's wrong with the car by discussing it or plugging in his little computer. He just can't do the manual labor anymore. So it's not the end of your life. You just have to work with it and figure out, what does this mean for my life now? What can I do that I enjoy that's not going to aggravate my condition? And so, yeah, that's where we are. So I'm sorry, my videos aren't usually this long. Well, I guess maybe lately they have been. I try to keep them 10 minutes because I have a short attention span, but maybe you could watch it in 3 chunks if you need to. Anyway, I just wanted to let you know a little bit about multiple venous malformations. If you have any questions, please comment. Or if you have any advice, comment as well. I do have a Patreon now. It's Positively Susie. And I welcome your support. I do have one patron so far, Mina Phillips. Thank you, Mina. You are awesome. And your support helps me to share things like this. All right. I hope you have a beautiful day. Bye.